Hi guys, welcome to today's vlog. I wanted to talk to you today about kidney disease. I was diagnosed a year ago, almost exactly a year ago, with end-stage kidney disease. My GFR at that time, which is the filtration rate of your kidneys, was, I think I was at a 16 or a 17 at that time. So my kidneys were only working at 16 or 17%. I've always had to deal with high blood pressure, and I've been diabetic now for approximately 10 years. I got my diabetes under control, and that doesn't seem to be a problem, but the blood pressure's always been out of control and has always been an issue. For the past year, I've been trying to take care of, be on the kidney diet and watch what I eat, and it's really difficult to know what you can and can't eat when you're on a kidney patient. They tell you not to eat. It's completely different from what you're taught when you're young. They don't want you having like wheat bread. They don't want you having stuff like Cheerios. No diet food like Weight Watchers or anything like that. They don't want you having like imitation salt. Bananas are bad for you. Melons are bad for you. No tomatoes. Dark sodas you're not supposed to have. There's a whole list of stuff that, the sodas is kind of typical. You shouldn't have that anyways, but, you would think like wheat bread is better for you, or, the, Cheerios would be better for you than the sugary cereals. And when you're a you have end-stage kidney disease, that's just not true. You have to watch your potassium levels, and you don't want a lot of protein in your diet. And you want to cut out salt. You definitely don't want to retain fluids. And then, of course, if you're diabetic, you need to stay away from starches, and you need to stay away from sugars. And so it just comes down to where you wonder, what is it that you can eat? There's really nothing out there, so you're always questioning yourself. Well, geez, if I eat that, that's going to hurt my kidneys, or if I eat that, that's going to make my blood pressure go up, or if I eat that, that's going to make my sugar levels go high. And it's just a constant, never-ending cycle. You just can't win. This is just like a merry-go-round that you can never get off. So, I try to enjoy what I eat to the most part, but I still try to cut back on everything, a little bit. I guess the saying goes that, everything in quantities is what you have to look out for. So, as of right now, my GFR rating, it's definitely gotten a lot worse. I am now down to a 10%, as all my kidneys are working. The doctors are wanting me to start dialysis, and as of right now, I have opted not to do that. I have really thought of this decision for quite some time, and I've done a lot of research. I've gone to quite a few classes. I've watched a lot of YouTube videos, and I've talked to a lot of people. Been on a bunch of kidney groups and Facebook, and I just haven't heard anything good really with dialysis. A lot of people never come off it. If they do come off of it because of a transplant, they usually end up back on it. Their transplant seems to not stick for whatever reason, whether they get an infection and end up having to go back on dialysis because of that, or they can't afford their rejection medication and their insurance won't cover their medication for any longer than 4 years. I've heard that quite a few times. So then they end up rejecting their new kidney and have to go back on dialysis. And then I've also heard that a bunch of people on dialysis have destroyed their heart, and they don't qualify for transplants for whatever reason. And, then there's others that have high blood pressure like myself, or uncontrolled diabetes, and they would never qualify for a transplant to begin with. So, and the saying goes that once you go on dialysis, you can never come off unless you get a transplant. And it's a lifelong road being on dialysis. I mean, it's painful. I mean, the needle they stick in your arm, it's horrendous. I can't imagine. They have numbing medication that they put on your arm, but it just seems so horrendous, and it just scares the crap out of me, I guess, to think that you have to go through that and sit in that chair for, 4 or 5 hours, 3 to 4 times a week, and I mean, your whole entire life is going to revolve around, I got to make sure I'm in this dialysis chair or I'm going to be dead. Now I know that if I don't do dialysis and I don't get a transplant, that I'm on borrowed time. I am not naive to that. I'm aware of that. And that just brings on a whole new set of anxiety and stress and problems. I am trying to get my affairs in order. And at the same time that I'm trying to get my affairs in order, I'm trying to enjoy whatever time I have left. I'm trying to enjoy food, but, to a point to where I'm not eating so much of the wrong stuff that it's going to make me die quicker. So I got to be careful there. I mean, I don't particularly want to be on a restricted diet because, I don't have long to live. But I also don't want to die next week if I can help it, by watching what I eat. So I'm kind of trying to be careful there. Still taking my medication for my blood pressure and trying to get that under control, but the kidneys are kind of controlling my blood pressure right now, and I'm pretty high, so you have to wonder if I'm going to die from my kidneys breaking down, or if I'm going to have a stroke, or if my heart is finally going to have a problem. I have migraines all the time. That's one of my biggest problems that I go through right now. I think I've always wanted to go online and talk to somebody that has kidney problems and ask them, what can I expect? The sicker I get, what are the symptoms that I'm going to have? And there really isn't anybody out there telling anybody this. I mean, you see some of the things that, you can possibly get, but I don't think I've ever really talked to anybody and anyone, get low enough. I think everybody that I've talked to that's on dialysis hasn't gotten as low as I am, with only being at 10%. And I think that's why I'm kind of doing this vlog, is to try and help those that have made the same decision that I have, and that they don't want to do dialysis, but they still want to be aware of what's to come or what could come, and so that they can make an educated decision on what's right for them and, how much time they may have. And I know everybody's different, and this is kind of my story and not yours, and your journey may be a little different. But every day I have these migraines, and they put me in this fog to where I really can't think straight. And it's really kind of embarrassing sometimes. I'll be talking to somebody, and if I do it here with you, I'm sorry, but I will get sidetracked and I'll forget where I was going, and I'll forget, my train of thought or what I was about to say, and I'll kind of just stare off in the distance, and then I'll kind of mumble and stutter and forget what it was that I was even talking about. And it's very aggravating and frustrating, and you still know that, geez, I want to get my point across, but you've lost your whole entire route that you were going. And it seems sometimes that it's impossible to get back to explaining. I'm sure everybody at one point or another has had what we call brain fog. The other issue that I have is fatigue. Oh my gosh, the fatigue is horrible. I take several naps a day. I am no longer working at this point. My husband does a lot of the chores around the house for me. I find that when I go to bed and then I get up, I'm more tired after I wake up than when I went to bed to begin with. And I'm struggling to stay awake. And I know, see, I'm yawning. Sorry, guys. I know that some of it's my medication, probably the blood pressure medicine that I'm on. It does a lot of the fatigue that I'm going through. And I know that the blood pressure, with it being high, I know that that is a lot of the cause of my migraines even. And then with the migraines and the brain fog and the fatigue and all that, it causes me to be dizzy. I find that the dizziness, it's like being on the teacups at all times. I mean, I'm just spinning. And it's a horrible ride. I don't mind spinning rides. I used to like them when I was younger. I used to go to the fairs or even ride at the teacups at Disney, and they never fazed me. You know, I never got sick or anything like that. But, I mean, sometime or another when you're on these spinning rides, you do want to get off. And this just never stops. So, it's overwhelming. It really is. It's just overwhelming when you're dizzy all the time and you have migraines constantly, 24 hours a day that you can't get rid of. And then you're nauseous a lot. Now, they say that nausea is a symptom of the kidney disease. I don't know if it's the kidney disease that's causing the nausea or if it's all of the medicine that I'm on, or if it's the constant spinning, the dizziness that I feel, if maybe that's causing me to be nauseous quite a bit. And then there's also this horrible taste in my mouth. The only way I can describe the taste in my mouth is it's like a sulfur waste taste. It's kind of like, I'm sorry if this kind of grosses you out, but it's the only way I can kind of describe it. It's like sucking on a tailpipe of a septic tank. I mean, it's a horrible, you can kind of smell it. My husband says he can't smell it. Thank God. I'm glad others can't. But you can smell it, and you can definitely taste it. And it's all the time. And they say that you get this taste, and a lot of kidney patients get this taste, from what I've heard. The lower you go, the more you're going to get this taste in your mouth. And it's because of the buildup of the toxicity in your blood. The more that your kidneys stop working, the more the toxicity builds up, the more that taste is going to be in your mouth. And there's nothing you can really do. I mean, I'll use mouthwash or, go brush my teeth or chew on some gum or something like that. But the taste is still always there. It doesn't seem to matter. Some foods that you eat, you'll have that taste and then you'll eat food, and it makes the food taste really gross because you'll have both. It's not like the taste will go away by eating something. Sometimes a toothpaste will help, but not all the time. The taste will still be there and will overpower it, or, try to blend with it, and it's not all that great of a blending. So that could make you nauseous also. So I have to keep that in the back of my mind while I'm eating, and I have noticed that sometimes I'm not all that hungry or enthusiastic about eating when the taste is really bad in my mouth. Other than that, that's enough, right? I think that's probably plenty of symptoms for me to say at this moment. The doctor has given me approximately 3 months left to live. He has referred me to hospice at this point, and I have not gone. I have decided to stay at home for now. I don't know how long I have. I mean, obviously, nobody knows how long they have. I am in good spirits at this moment. I'm still walking. I don't have any problems walking. I am retaining fluid. That is another symptom, but that's typical for kidney patients. I try to keep my feet elevated as much as possible. I rest when I need to rest. And, I'm just trying to enjoy life and trying to get my affairs in order and making sure my husband and my pets will be taken care of when I'm not here. And that's really about all that I'm doing at the moment. I will try to keep you guys informed and up to date on anything and everything that I do. If I end up going in the hospital for whatever, I'll take you along with me and show you or tell you what it is that they're doing, and we'll just take you along on this journey and we'll see where we go. And I think that's about all there is for today's vlog. So until next time, guys, thank you very much. Peace.